Okay, so again, I feel like I could talk about this for hours and have a whole episode just on this one particular subtopic. Um, I do think that if you're looking at ads side by side, if your ad is no different than another ad and your offering is no different than another offering, and there's nothing even tantalizing enough for them to get to call you versus another ad, there's a good chance it's going to fall flat. And if you happen to be in a rural area, which I was for 3 of my practices, then you have to even get more creative when it comes to that, right? So again, it comes down to math. It really does. I remember there's another fear-based something about bringing associates on. It's like, well, what's the percentage? What's the compensation? Is it crazy to say that I would offer them like a signing bonus? Like, is that just going to be money that I'm going to throw out the window? Once again, you have to have a really, really good reason or good way to separate yourself from the masses that are looking for associates, especially if you're in a rural area. So if that means signing bonus, if that means flexible hours, if that means more paid vacation, if that means a slightly higher percentage when it comes to compensation, there needs to be something that you come up with as like a radical differentiator. And when it comes to something like, let's just say a signing bonus, okay, there's ways to do it that decrease the actual risk. You could amortize that out over 6 or 12 months. So I know it's crazy, but I had a $20,000 signing bonus. And this was, for the last 5 years that I owned dental practices. And it worked out really, really well because I amortized that over 24 months. They had a $20,000 signing bonus. And every month that they stayed, they got a little bit more of a bump on their paycheck for that actual signing bonus. But I mean, the $20,000 signing bonus got people to answer that ad and consider moving to a rural area. And then they realized that it was a great area to live. And we had tons of production and lots of new patients for them. And that what happened to be my radical differentiator. But you do have to look at the math. So if I'm looking at, oh my goodness, that's an extra $2,000 a month I'm going to be paying towards a signing bonus for 20 months or for 12 months, that's crazy. I don't know if I could even stomach that. It's like, we'll do the math. Like, how much is one associate, even if they're a semi-decent associate producing $75,000 a month, how much value are they going to add to your practice as far as profitability if you're at a 50% overhead, if you're at a 55% overhead, if you're at a 60% overhead? I guarantee that $2,000 per month for that signing bonus is going to be insignificant. So those are the sorts of things that you need to make sophisticated business decisions about something that you may feel emotional about. Like, I was never offered a $20,000 signing bonus. Why should I offer some brand new kid out of school a $20,000 signing bonus? Well, here's the reason, and here's the potential upside for that.